So these are a little bit bigger pieces, Susie. You're doing great. Doing great. So she was saying some words to me this morning. I wasn't able to understand the meaning, but they were full words. And I am so excited that that's happening. Becca's going to help you with that, Susie. Okay. So we got scrambled eggs, pancakes, oatmeal.
And then Sue, if you have any food stuck in your cheek, I want you to try using your tongue and kind of get it unstuck. Good job.
Do you need something? Becca, I'm sorry for interjecting myself all the time.
No worries.
I just want to be helpful, and sometimes I think I get in the way. Don't I, Susie? I get in the way a lot. I don't want to be in the way. Oh, man. This is hard for me.
I have her scheduled, well, I requested her speech tomorrow to be scheduled around lunchtime.
Okay.
So we can try another song.
Okay, great. That's awesome.
Some other food.
This food looks great. I don't think she's going to want to come home to my cooking.
I think you, in that little cardboard container, some rice porridge if you like congee.
Becca, is it possible for you to check to see how much of her dinner she ate? She didn't eat any lunch yesterday.
It looks like she did not eat any dinner last night.
No dinner, okay. So this is her first food since breakfast yesterday.
I believe so. You want to take a sip of you have some almond milk here? No pain? Here, let's try this. Are you in any pain? Yes or no? Yes. What hurts? Something hurts though. Okay. Let me run through some options. Does your head hurt? No. Okay. Is it kind of an all over discomfort? Okay. Make sure to let your nurse know.
I checked with the nurse this morning about her. She had a uterine, or not uterine. Gotta be careful with my words here. Urinary tract infection, and she said that Suzy had completed the course of antibiotics. Yes.
Yeah.
And then a day after she was admitted in to this unit, she was having pain in her left knee.
Okay.
And they initially started with Tylenol, and it persisted. I think the Tylenol helped a little bit. It persisted, and they gave her something else. They said people that have had strokes, it's not uncommon to have a variety of body pains, and they had a name for it. I don't recall what that was. So they have just given her, I believe, pain medication as needed, but I don't know what the frequency was of that.
Do you think you'd like some Tylenol? No Tylenol?
Part of her course of morning meds includes a baby aspirin. It's primarily as a blood, kind of keep the blood thinner.
This looks good, Sue, though. You're chewing and swallowing up the bigger pieces. Pretty good. There's no food or liquid falling out of your mouth, so that tells me your lip strength is strong. Holding everything in nicely. Yeah, we'll see how this goes, and then we'll chat about if you feel ready to bump up to the soft and bite-sized. looks like Sue did take all of her morning meds today.
Well, she took aspirin, Tylenol, and thyroid. There's other stuff that I don't believe she had.
Aspirin, and then she has her heparin injection.
No, didn't take that. She hasn't taken any of those injections that I'm aware of.
It looks like she got it today.
That's not right. It's in the drawer and under the cabinet.
Around 8:10 this morning.
Yeah, I was here.
Oh.
Yeah. So,
Her thyroid medication. And her
Becca, could I just talk with you kind of about what I see happening right now? And I have a few questions.
yeah.
I don't want to disturb you doing your reporting. So this is what I'm noticing with her. On Sunday, she was making sounds, but I couldn't understand any words that she was speaking. But they were multi-syllable. It wasn't just short little burst. It was longer than a.
Okay.
And then today, intermittently, she was using whole words, the words I could understand. They just weren't coming together as a sentence that I could understand.
Okay.
Or even the small words weren't, I wasn't getting what she was trying to communicate.
Yeah.
And so I didn't know if the word, maybe the word was the word she wanted to say, or maybe the word wasn't the word, but that was the word that was bubbling to the surface. And I'm seeing some kind of progression here, but I know she hasn't been doing the therapy with you. And so I'm quite surprised that it looks like she's making some progress, even though she's been turning you down. So I was wondering if you can give me some insight. I know every stroke patient is different.
Yeah. You know, sometimes the patient's motivation for communication can be the reason why she's talking a little bit more now compared to before.
Okay.
Sometimes with, you know, the transition here, a new environment, lots of new people, that can cause people to kind of withdraw.
Gotcha.
So the want to communicate with new people, familiar
Yes.
people can be a little
Yes.
bit more shut down. But she has been in here a few days and she's a little bit more used to the routine of
Yes.
here. I think that can help that motivational factor of like
Okay.
a little bit more comfortable now.
So it sounds like it may have always been there, but now it's being expressed.
A little bit more
Okay.
spontaneous.
Not so much that, I mean, what I'm wondering is, you know, they talk about brain plasticity and how the brain has the capability of doing what other areas can't do any longer. So I was just wondering if that was a
It
component.
can definitely be a mix of a bunch of
Okay.
things. But sometimes patients do better with lots of intensive rehab right off the start.
Yes.
But then other times people just need more time.
Yes.
And that time allows that spontaneous
Right.
recovery where the brain kind of adjusts
Yeah.
a little bit on its own. It depends person to person.
Yeah. Well, you know, all the therapy here I know is so important in terms of making some level of progress. But Suzy was such a verbal person. I think that the speaking and communicating is the thing that she probably misses the most, is probably most frustrated with, like when she's trying to communicate to me in pretty strong terms and emotioning, and I'm not understanding. I know it's frustrating for her. It's certainly frustrating for me because I want to help her.
And then sometimes we'll have patients who don't do great in a hospital, but as soon as they go home, back in a familiar home environment, something just clicks and things progress even more
Oh, really?
when they leave the hospital.
Okay.